Health and Wellbeing Queensland acknowledges the Yagara and Turrbal people, the traditional custodians on the lands on which this podcast was recorded, and the traditional custodians on the lands and waters on which you are listening. We pay our respects to the Aboriginal and Torres Strait Islander elders past and present, for they hold the memories of the traditions, cultures and aspirations of Australia's First Nations people.
I think it's really important to really encourage parents to get down and have fun with their children and to make communication as interactive as possible. And that might be when they're really little, lots of animal noises, and when you're playing truck noises so that children have a sound to try to copy or imitate. And as they get older, sitting and sharing books.
Hi, I'm Dr. Sam Manger, a GP and your host of this series, The Clinician's Guide to the First 2,000 Days, brought to you by the Queensland Government through Health and Wellbeing Queensland. Prevention across the first 2,000 days offers an opportunity for healthcare professionals to support generational health improvements. But preventative health will only be successful if it is done with confidence and empathy and an evidence base. Over the course of this series, I will be talking to some of Queensland's leading experts to explore how they discuss preventative health and how to create meaningful change for the next generation. Let's get started. As infants grow into toddlers, some of their most important milestones come through communication. To look at how that speech and language develops, today we have Kim Dunston and Stephen Moore joining us. Kim has been a speech pathologist for over 25 years in Australia, New Zealand and the United Kingdom, working across early childhood education, health and community organisations. Kim is currently working at the Centre for Children's Health and Wellbeing to look at early intervention opportunities to improve health equity. Stephen Moore is an oral health therapist with over 35 years' experience. He works at Metro North Oral Health, working across the Queensland Children's Hospital and Oral Health Centre at Hurston, working to support children to access oral health services. Well, thank you both, Kim and Stephen, for joining us.
Thank you.
Thank you, Sam.
Okay, so Stephen, let's start with you and some important questions here around development. What is typical teeth development for babies and toddlers?
Yeah, nice place to start. So generally we say most children have two sets of teeth. First set we call the primary teeth, and the second set being the permanent teeth. So the first set of teeth, the primary teeth, generally start coming through the mouth around the age of 6 months of age. And usually it's the lower front tooth that appears first, then followed by the top teeth. And then we go from front to back, and then usually by the age of 2.5, 3, we have all 20 primary teeth. Some children do have extra teeth, what we call supernumerary teeth, and some children also are missing some teeth. But generally by the age of 2.5, we would say that we've got our first set of baby teeth.
And when should adult teeth emerge? So as you say, it's a process, but
Yes.
What's the sort of timeline for that?
So usually your first adult tooth starts appearing around the age of 6 years of age.
Mm-hmm.
Okay. And then usually by the age of 12, we've lost our last baby tooth. And then we have the last adult teeth, if we have them, are the wisdom teeth, which can be any time from 18 on to 20. But usually the first set of baby teeth, we have from around the age of 6 months till 12 years of age.
Wow, so they're around for a while. And what sort of potential underlying issues, concerns can impact the development of teeth?
Oh, Sam, there's so many conditions that can cause disturbance in the tooth formation. There's so many different types of syndromes that can cause delayed eruption of teeth. But I'd say probably the best way to answer that is if it's not in the normal range, then it's certainly worthwhile getting an appointment to see a dentist. There's some great information on the internet which gives you good graphs of, what age to expect primary teeth to come through, what age they fall out. And I would just say if it's not within the normal range, then that'll be a perfect opportunity to seek dental care.
And some of the common problems that parents will experience and health professionals therefore will experience are things like teething pain that children will come in with, or wobbly teeth that could be distressing them. So are there any tips or tricks around managing that?
Teething's a really tricky one, and it's probably a question we get asked nearly every day. Classic signs of teething is you have a more upset child. We sort of see rosy cheeks, we see a little bit more saliva in the mouth, they're uncomfortable. It's a tricky one to try and manage because you can get teething gels that assist with teeth coming through. You'll see generally in the mouth like a little lump that the tooth's not far off from coming through. And it's just trying to, sometimes some pain relief will certainly help. Sometimes teeth may take a week or two to actually come through. So the advice we would give parents is just to try and make your child comfortable. Sometimes chewing, like you can buy teething sticks, and sometimes even just like eating on a cold carrot stick can also help with teething, or toothbrush in the mouth just to help stimulate the tooth to break through the gum. So it's initially, the discomfort is before the tooth breaks through to the gum. Once it's broken through that gum, the discomfort sort of settles.
Okay, yep. So a variety of little techniques that people can use there. I've certainly seen those little mesh ring things where you can put ice cubes in there and the kid
Yeah,
can
and that's
suck on
certainly
those
available. You can buy them from supermarkets, chemists, little teething rings. It's comfort, I think, like something that will help soothe the gum that's sort of causing the irritation.
When should children first see a dentist or an oral health therapist, and what would be the sort of recommended frequency for that?
My advice, I would like to honestly see that we start seeing the child at the age of 1. Some information there, you see them at the age of 2 when they've generally got most of their baby teeth. But sometimes seeing them at the age of 2, it's too late. So I would love to see that we really introduce that first dental checkup around the age of 1 year of age.
Excellent. Looking now at speech and language, what's the difference between speech and language that make up communication? Then what are the typical communication milestones that babies and toddlers express?
So communication is made up of 2 main parts, and they're often confused. So it's really important when we're talking about communication with families that we're using the right terminology. But speech itself is the words or the sounds that we make and how we put those sounds together to make words. You might have heard it called articulation before. Speech is also made up of voice and fluency. So sometimes if children have a stutter, then that's a disfluency. On the other hand, we have language, and that's the words that children can understand or comprehend and the words that they learn to use to express themselves, and the way they put those words together to form sentences, the way they use those sentences to get across their meaning, really. Communication is all of it put together for children to be able to get their needs and their wants met. And it's really important. It's such a crucial part of a child's development, and it really can impact on how they go when they get to school, the way that they make friends, and those later skills that they learn down the track. Although babies are not using words when they're born, communication starts right from birth. And so it's great to know that sort of milestone that happens right from birth. Babies are cooing, they're crying, they're smiling, and as they get older, they're waving and pointing and things like that. And that's all communication. Between 12 and 18 months, that's the time we're seeing children's or toddlers' first words. It's a really exciting time for families, and that first word is often something familiar in their environment. Could be someone's name or a shoe or ball or a favourite pet or something like that. So something that they're hearing a lot. Now, from 12 months and that point of time, babies are understanding more than they can use. So even little short phrases they're understanding at 12 to 18 months, and the words that they can use, so the expressive words, is just growing all the time as they're hearing adults and other children using words. And by the time they have about 50 of those words, they start to put them together to create little 2-word sentences. And if children aren't doing that by about 2 years of age, then that's when we would start to be concerned, I suppose, and encourage parents to go and speak with the child health nurse, their GP or speech pathologist. You can imagine speech and language is quite a complex skill that children learn, and it really grows over time. So as they get older, the amount of information that they can take in and respond to and the complexity of the language and the words that they use grows as well. So by the time children get to 3 and 4 and 5 years of age, they're using quite long sentences, able to understand jokes and quite long instructions and predict what might happen next and tell you about something that happened the day before at kindy. So their language just becomes a lot more sophisticated over time.
Is it true that in families where they speak multiple languages that there can be a delay in the language, but obviously it comes and it develops quite rapidly thereafter? Is that true, or is that a myth? Or
it doesn't actually cause a delay in the language. I think children who are bilingual or multilingual are very lucky, and having another language has got really positive impacts on not just learning another language, but other skills that they might use at school. What it can do, though, is just change the order or the way that both languages might develop. It's really important to tell families that they should be using their home language at home because that's their most prominent and solid language, and it makes it easier for their child to learn a second language like English once they have a really good, solid base.
So working with, as you said, primary language and then building on top of that, and sometimes expect some potential mix between the two.
Correct.
As it flows between the two.
They'll often mix up the different languages within the same sentence, and that's actually a really normal part of being bilingual.
And Stephen, how does the development of the teeth affect speech progress? Because this is obviously a pretty rapid process where the brain is learning, the fine motor skills of the mouth and the jaw and the tongue are learning, as well as the teeth changing. So there seems to be a bit going on in that region.
When we talk to parents of why we need teeth, we say we need them for eating, we need them for talking, and we need them for appearance. And Kim would probably want to add to this that the impact that teeth have on speech and the position of the tongue plays a huge role in speech.
Slightly later, erupting teeth doesn't have a big impact early on because the first sounds children use are lip sounds and don't involve teeth too much. But later on down the track, the tongue is placed against teeth or on teeth, to be able to produce certain sounds, and they are important in the production of speech. And if you might lose teeth early or you have knocked one out and it's gone for a prolonged time, then it can distort talking, I suppose. But usually that will rectify once the teeth are back in place.
Yeah, fantastic. And so what are some of the other potential underlying issues that can affect a child's speech or language development?
Most children do learn to talk without any direct teaching, but there are some children who might just have delayed language, and with a little bit of more direct, talking and strategies put in place, then they will catch up. However, there are a number of conditions that coexist alongside speech and language difficulties, and they include things like particular syndromes that might affect communication. There might also be family history, which is considered relevant in speech and language development, and recurrent ear infection, so otitis media, has a really big effect because if children have got fluid in the ear and all they're hearing is muffled sounds, then they really can't hear the adults and the children around them, and that's who they're getting their language models from. It's not really just the medical conditions, but we know that environment plays a really big impact as well. Children need adults and other children to imitate. That's how we learn language. And if they're not hearing those language-rich environments, it's really difficult for them to be hearing really good models of language around them. And that's where, as professionals, we can have a really big impact in trying to nurture families to produce or to, have really rich language-rich environments at home.
What are some common signs, and there will be many, but what are common signs of speech and language delay in toddlers, and when should parents be concerned?
There is a really big variety and a big range of normal and typical development in children, but there are a number of, we would call them red flags, I suppose, or milestones that if children haven't achieved by a certain time, then we would encourage parents to see a GP or talk to a child health nurse or refer themselves to a speech pathologist. And there is actually a document called the Red Flag Early Identification Guide that can be used by health professionals to see what those red flags are, but also to help guide that discussion with families. Just as a bit of an example, at 6 months old, if children haven't started to babble yet, then that would be something that we would look into a little bit further. At 9 months, all those other communication things that I spoke about earlier, so gestures, waving, pointing, and if at about 9 months that's not happening, that's also something to be concerned about. And so if we're getting to about 18 months and there's no clear words yet, then that's a really good time to have that chat with a child health nurse as well. As time goes on, at 2, if children aren't starting to put 2 words together, that's another point to think about. And at 4, if speech sounds children are still really difficult to understand by family and friends, and that's another point. We would expect children at 4 to be about 95% intelligible or able to be understood by family and friends. By 5, when children are basically nearly at school or they're there already, if they're not able to tell a parent what is wrong or what their needs are, then perfect time to look for other support.
You mentioned there a range of sort of verbal and non-verbal cues that can indicate communication concerns. You said it's not purely verbal, but there's a number of really clear flags or benchmarks that you've laid there. Thank you. Stephen, in terms of oral health care, we know parents should start brushing teeth as soon as they appear. However, what is the age you would expect a child can competently brush their own teeth independently?
So we generally say usually by the age of 8 to 10, children should be able to brush effectively by themselves. But we see an awful lot of teenagers that still can't brush effectively. But we certainly encourage, say, from the age of 2, and this is when children, start becoming a little bit independent quite early, as they want to sort of control the brushing by themselves. But we really emphasise the importance that parents should go over the brushing and supervise the brushing after, the child's had to go because we just find they can't brush effectively at 2. Usually by 8 or 10, we're fairly comfortable and confident that they are brushing effectively.
Despite the 2-year-old toddler's confidence that they can do it.
Yes, that's right. The terrible 2s.
Yeah, there's still a role for us just to have a quick second turn.
Yeah. Can I just add though, Sam, I know we're sort of focusing on the toothbrushing, and the important thing I like to also add is the importance of flossing. Basically, each tooth, we say, has 5 surfaces. Your toothbrush can only get to 3 of them. So your toothbrush is reaching like the outside, the inside, and the biting surface. Where your teeth are in contact, the front part and the back part of the tooth, no matter what toothbrush you buy on the market, it won't go between the teeth. So we really encourage flossing as well as brushing.
And how often?
So I'd be saying brushing teeth twice a day and flossing teeth once a day.
Right, flossing once a day.
Yes.
And are there child easy flossing equipment? There must be some techniques.
Yeah, there are.
Here.
So there's some flossing gadgets on the market, like floss sticks, which is basically like a wishbone with a tiny bit of floss. So it assists parents to floss children's teeth, but also to help a young child holding the stick and going between your teeth rather than grabbing a strand of floss, wrapping around your fingers. So there's certainly some gadgets out there which make flossing easier.
Great. And with the types of toothpaste, how does that change over the age span?
Yeah, so when you're going looking to buy toothpaste, you'll see on the actual toothpaste you're buying the age range that they recommend that toothpaste to be used. So obviously for a child, there's junior toothpaste, which has a lower dose fluoride concentration, and that's usually like 0 to 6, and it's clearly labelled that this is a toothpaste till that age, or 2 to 5. So depending on what brand you buy, it's more low mint. So they're not as hot or spicy as, say, your adult toothpaste.
And we know fluoride is found in foods naturally. However, do you feel fluoride is safe for children when in toothpaste and water?
Yeah, well, I mean, I'm obviously completely supportive of fluoride in toothpaste and in water. In water, like we know, Brisbane water is fluoridated, and I think the current percentage is about 0.8 parts per million. Toothpaste, junior toothpaste, are 1,000 parts per million of fluoride. But the way I like to describe it to a parent is when you go out to the sun, you want to protect your body, you're putting sunscreen on. And the same for your teeth.
And do you have any sort of tips or tricks for parents who struggle with brushing their kids' teeth in the sense of their techniques or resources that you find helpful in that regard?
Yeah, there's some great videos out there. There's some great fact sheets on brushing technique, and they're certainly directed towards children. Like we've got the Wiggles show a toothbrushing video, Bluey, Peppa Pig. You know, they're all there. Great resources to show toothbrushing technique. But basically, we're pushing that. You know, we're brushing the outsides of the teeth. We're brushing not only the tooth but also the gum. So we need to be sort of massaging the gum. We talk about a 45-degree rough angle that you're sort of angling the bristles into the gums, but it's more like a circular action on the outside, circular action on the insides, and then scrubbing the biting surface. But there's some great resources, some great videos which assist in helping parents brush children's teeth.
I think once you mentioned Bluey, I think we've sold. Case closed. So that's good. Thank you for those resources.
Yeah, Brisbane's own Bluey.
That's right. Pride and joy. Kim, so let's move on to some other lifestyle preventative behaviours, in particular those that impact speech and language. So we know, for example, that too much screen time can be a negative for all humans at all ages, but toddlers in particular can be vulnerable. What are the guidelines around screen time in toddlers, and how much does does too much screen time impact speech and language development?
So screen use is in the media a lot at the moment, so it's a really pertinent topic to be talking about. The official guidelines in Australia is actually no screen time at all for children up to age 2, and then it's an hour a day for children aged 2 years to 5 years. And research actually shows that most Australian families find that really difficult to adhere to. What we do find is that for every moment in time, I suppose, that your child is on a screen, it just means that they're hearing less words from the adults around them, and there's being less interactions between the adult and the child, and that's what we know grows children's language and brains. So it does make an impact, and I think it has the same impact as not hearing the adults talk around them. It's really reducing that eye contact and the natural interactions that we have between each other.
It's interesting, isn't it? Because you mentioned the sort of opportunity cost there. Despite the fact that they're listening to a screen that might be talking still, it's still not as effective as actually being with a human in person, seeing the way their mouth moves, listening to the sort of dynamic flows. That's a big difference, is it, between, say, seeing a human on a screen versus seeing them in person?
Correct, yeah. And for a long time, we really thought it was just the number of words that children heard, that families from less socioeconomically disadvantaged areas use less words with their children, and that's all that mattered. But we now know that it's actually the interactions, the serve and return and the talking between adult and child that makes the biggest difference. So even if there's a TV going on in the background with lots of words being said, it's not helping as much as if you just sat down and shared a book with your child and talked about the pictures or told a story or looked at a picture and talked about what was happening.
It does open it up so much more, doesn't it, around this concept of communication, that it's not just hearing words, but actually understanding what those words mean, understanding the context of those words, understanding how to use those words appropriately and correctly. And you can only learn that when you're actually in conversation, particularly, and you can only question and probe around those sort of things. Do you know what that word means? No, even though they've been hearing it lots.
That's right. And it's not just the language then, it brings in social skills and interactions and connecting with your child. And we know that children learn best when they're in that kind of safe and secure environment, and sitting down and having that interaction is what helps that happen.
Yeah, that's very interesting. So on the flip side of that, though, are there any benefits of using screens to support language development?
I think there are some benefits. To start with, I think adults do need some strategies to be able to live life, and it's not realistic, I don't think, to say no, screens are terrible all the time. It's a fact of life. We all use screens, and it's just about using them in a positive way. We know that the number of books in a child's house has a really big predictor into how well their language is going to develop. Some families can't afford books and toys and things like that. But if you go to a library website where they might actually have videos of people sharing books, then that brings in another element of how you can interact with your child with perhaps not having books yourself. It's an on-the-go way. So I think so long as you are sharing what is on the screen with your child and then creating some conversation and interaction about that, then that can be used in a positive way.
Stay with us. We'll be right back to continue our conversation.
Rising rates of chronic disease are one of our greatest public health challenges. 2 in 3 Queensland adults and 1 in 4 children live with overweight or obesity. We need to shift the dial. That's why Health and Wellbeing Queensland has created Clinicians Hub. Designed for health professionals to support preventive health, Clinicians Hub is a digital ecosystem of initiatives, resources and tools such as podcasts. It supports clinicians with referral pathways, models of care, education opportunities and more. Find out how Clinicians Hub can help you at hw.qld.gov.au/hub.
And now, back to the conversation. Are there any apps or tools that speech pathologists, I imagine, use a variety of technologies to support their patients, but are there any public-facing apps that are good or programs that are good?
We would suggest using the First 5 Forever website. There are lots of recordings on there with different presenters sharing books with children. That's a really positive one. The Raising Children's website has lots of information and videos about interacting with your child. Even YouTube, which can be used for songs and sharing nursery rhymes, because it's not just sharing books that's really important and helps build communication, but singing nursery rhymes. And it's how we learn about concepts, Jack falling down the hill and all those really fun songs that you can add gesture into is really important. But there are lots of different resources that you can use to get ideas on how to actually just build that interaction into your daily tasks at home as well.
I mean, that opens up this concept of engagement and conversation and making it fun, opens up this question around play. And it's such an important and effective tool in our relationship with children and the development of their cognitive and social and emotional aspects. So how can healthcare providers involve play specific to your field? So speech and language and communication, then obviously oral health as well. So Kim, we'll start with you.
Play is how children learn, and that's often how we'll speak to parents about play as well. It's the job of children, I suppose. They take in it gives you a good environment to use lots of different types of words and for children to imitate and copy what parents say and what other children say as well. That's how we learn language. you can create lots of different environments in play that you might not even have access to at home. You can create kitchens, you can create the zoo, you can create the doctor's surgery and set up little pretend play situations. There's lots of different stages of play, and I think as children grow, the type of play that you would do with your child changes. And I think it's our job as parents to enjoy that play and just take it to the next level to help your child move on and use lots of different language.
Stephen, do you find it's an effective tool, play, in teaching children about their teeth and oral health?
Yeah, definitely. I think we certainly see children bringing their own dolls in and them brushing their, the doll's teeth. So what you're encouraging, it's a good habit and it's okay to bring play into that. I remember when I was brushing my own children's teeth, we used to sing songs. You want to make it a fun experience because brushing teeth is not traumatic. So you want to bring play into it 100%. And like Kim said, like you can create doctor's surgeries at home. You can certainly create healthy eating picnics at home. So all bringing in the importance of good oral health care.
Yeah, I've certainly noticed that with even just my own kids. Making funny noises while you're brushing teeth, for example.
Yep.
Just they're like, oh, what's going on here? This is fun. And they just stare at you the whole time. So
yeah, because it's almost like the art of distraction. Like we're literally pushing for 2 minutes.
Yeah.
You're trying to distract your child
exactly.
from
How can I engage
what
them?
I want to achieve.
Yeah. And I think that's how a lot of clinicians get their strategies or their goals done, that they need to work with this child.
Yes.
Play's a great distractor, but it's also replicating what's going to be happening at home. And so then you're, in a way, showing families and parents how to carry this on outside the clinic.
Yeah, exactly. I think it's the same sort of techniques clinicians will often use when checking ears or mouth. Is if you can just turn it into a little bit of a game or do that distraction bit, then it makes it a lot easier. And these are skills that are effective across the board. One of our other guests in one of the other podcasts talked about kids in the context of being play coaches. And I love that terminology because it's right. They will often come up with, they'll indicate the game. You just need to go along with it. When we look at parental well-being, Stephen, how can we better support parents who experience struggles with their own healthy habits, such as oral health? And how can we support them to be the best role models they can be?
Yeah, that's a good question, Sam. And we really encourage parents look after their own oral health. There's a lot of evidence that if a parent has poor oral health, poor dental, they've got a high concentration of bacteria in the mouth and we can almost pass it to our child. So the importance of a parent looking after their teeth. The impact that we have as a parent plays a huge role in the oral health care future of your child. It's okay to brush your teeth together as a family. So it's really, I think, putting the emphasis that as a parent, we need to display good habits. And yes, it's hard bringing a child up. I've had 2 children. They don't come with a manual. It's a hard gig. But as a parent, we have a huge, huge impact on the life of these children's, their teeth in particular.
And Kim, along the same lines in sense of role modelling, particular to communication development, what can we do with respect to from a parental point of view?
I think it's really important to really encourage parents to get down and have fun with their children and to make communication as interactive as possible. And that might be when they're really little, lots of animal noises, and when you're playing, truck noises, so that children have a sound to try to copy or imitate. And as they get older, sitting and sharing books. We know that not all parents have had really good experiences in the past themselves with going to school or books or going to the library. And I think acknowledging that and sharing information about services that they can go to so that they're not having to feel the pressure of providing all of the teachable moments for their child. So things like going to the library for story time sessions. Not only do children get to play and interact with other children, but the parents are receiving modelling from the other parents and the facilitators who were there as well. Play groups are really great for that. And even early childhood education and care services is really beneficial for children. I think just those discussions that families have with educators can really show them what their child likes to do and how they can interact with them. But I think most of all, talking, singing, having fun and playing with your child, and that it's actually okay to be silly. It's a hard thing to do for some people, though. It's not natural.
It's great to be silly. Silly is good. Tick of approval. Now, Kim, 2 of the most common surgeries performed in toddlers is a tonsillectomy and grommets. In your experience, do children requiring these surgery experience problems with their speech and language development, or to Stephen as well, to oral health?
In terms of communication, probably in the lead up to the surgeries is when we would see the most difficulties. With the tonsillectomy, if you have got really big tonsils sitting at the back of your throat, sometimes it will impact the types of sounds children will develop, and it might mean that instead of the really sounds we use at the back of our mouth, they use sounds at the front. It might change the resonance of a child's voice. And if they're not able to breathe very well through their nose because of that, they might breathe through their mouth. And that just changes sometimes the structure of where their tongue sits. And if it's ongoing, then it can change their speech pattern. But often when their surgery is over, then those patterns often will self-correct. And with grommets, like I said before, children who have ears full of fluid can't hear around them. And so sometimes you'll see delayed speech and delayed language. But once grommets are inserted and their hearing sort of goes back to normal, then that will usually pick up.
Is there anything that parents can do in the interim while they're waiting for those surgeries? Because every health professional will know that the waiting list, especially for ENT specialists, can be quite considerable, sometimes years. And so is there anything we can do to reduce these symptoms or potential impact on their communication?
It probably would be just being more aware of when you're talking to your child, if they are waiting for grommets and they do have lower hearing or muffled sounds, that you are just using a higher volume, that you're making eye contact, they can see your face, and that sometimes using exaggerated sounds is helpful. But really it's using those same strategies I've talked before, getting down, talking to your child and sort of being led by what they're interested in.
And as you say, being aware that you may need to have a little bit more attention to this, pronounce your words a little bit more clearly, say things a little bit more.
Yeah, just being more aware of your modelling, I suppose.
Yes. And Stephen, one of the most common avoidable hospital admissions in children under 5 is tooth decay. What are the main signs we should be looking out for?
Early tooth decay, do we see it? I'm going to say yes and no. First of all, early signs of tooth decay is you can be looking, and it's going to sound weird, a little white spot appear on a white tooth, different type of white, to a small white spot, to a yellowy brown, to even like a black spot on the tooth. So that's usually the early sign of decay. Is it easy to see? Not necessarily. Sometimes when parents or health professionals see it for the first time, they're quite large lesions to the point where it's going to need extensive treatment. So once we start seeing a large, black, broken down tooth, then that's extensive tooth decay. And unfortunately, we still see a lot of tooth decay, which is really sad because it's something that's totally preventable. So in the last Australian Institute of Health and Welfare report in the year 2020, it was $5.1 billion was spent on dental decay in children between the age group of 5 to 9 in hospitals.
Wow.
So there's a huge burden of cost for a disease that's totally preventable. As a parent or a health, non-dental person, a simple lifting the lip and having a look in the mouth, you can certainly see signs of issues, which then trigger you to seek dental care.
And what are the main causes of tooth decay, given how prevalent and what an impact it has?
First thing we need is bacteria, okay? And we know our mouth is full of bacteria. But for the bacteria to actually cause a hole in a tooth, we need an external factor, and the major factor is sugar in the diet. So what happens, bacteria can break sugar down, or bacteria does break sugar down. It produces like an acidic environment. And so it's basically sugar, the amount of sugar we have, the timing of the sugar we have, causes holes in teeth. We used to have 3 meals a day, breakfast, lunch and dinner. But now we put morning tea in there, we put afternoon tea, and we now class that we're more snacking or we're grazing on food. And if we're grazing on a diet that's relatively higher in sugar, then that's going to increase the risk of holes in teeth. So we're not just talking food, we're talking drink. And if you put cordial or juice or something sweet in even a sipper cup, the problem with that is that you're drinking or just sipping that drink over a long period of time. So we would honestly push, if you're going to have something sweet, almost drink it in one go. It takes roughly 40 minutes for our saliva to re-neutralize the mouth. So if we're sipping or snacking on like a bag of M&Ms or whatever, and we're not eating all in one go, those teeth are sitting in that sugar environment for a longer period of time. So ideally, we're to have something sweet, have it with a main meal. And then how we can sort of then counteract that sugar is through brushing teeth straight after, drinking water after. To answer it once again, the simple thing, it's sugar is your major factor that contributes to tooth decay.
And how does that affect the teeth? Because there's concepts I've heard around hypomineralized teeth and how this can impact a child's health. Is that because of these foods and bacteria and also dietary intake, or what's the basis of this?
Yeah, so what happens when we have something like sugary, the bacteria that's in your mouth converts that to acid, and it's the acid that slowly is almost sucking the minerals out of the tooth. So the tooth becomes softer over a period of time. It doesn't happen overnight. But if we've got a diet that's high in sugar, that means our teeth are sitting then, as a result, in an acidic environment. So your minerals are almost coming out of the tooth. And once your outer layer of the tooth breaks down, the enamel, the second layer, what we call the dentine, is quite soft, and that's when the decay, the infection really takes off. So you mentioned before about hypermineralized teeth. So hypermineralized teeth, and we see a lot, it's just where there's a disturbance in that formation of the enamel. So basically the tooth starts off already soft. So there's less mineral. The tooth is softer, prone to bacteria attack and acid environment, and easier and quicker to decay.
Are there any other foods, sugar is a clear one, that are negatively impacting the teeth?
So we're talking really your confectionery food.
Mm-hmm.
We know we have natural sugar in foods, and like in particular in your fruit. This is so classic when we have a piece of pineapple. Pineapple's extremely acidic, but as soon as you have a piece of pineapple, you almost get this little zing in your mouth, and that's your saliva is kicking in to literally buffer the acidity of the fruit you've just had. So our natural sugars generally are okay. So in your fruits are fine.
So natural sugars are generally okay because our body has evolved to respond to them appropriately, in the sense of it's a natural response, aka a buffering response occurs. You mentioned there around starches may not be good, so that's interesting. So let's say whole grains or complex carbohydrates, brown rices, whole grain breads, they can still be detrimental to the teeth from that carbohydrate point of view, that load?
Yeah, but not as much as, say, just straight out your sugary snacks. The bacteria's got to work harder. And I think this is why we really encourage brushing teeth twice a day. So we need to almost disturb it twice a day to reduce the bacteria load. So preventing holes in teeth, it comes down to reducing bacteria and reducing sugar in the diet. So if we had no bacteria in the mouth, we wouldn't have holes in teeth. If we had zero sugar in our diet, we probably wouldn't have holes in our teeth. I see a lot of patients which are nil by mouth, and you don't see tooth decay because there's not that external factor, that external sugar going into the teeth to cause that acid environment.
You're making me want to brush my teeth, Stephen.
Good. And floss, Sam.
And floss. Never forget the floss. I'm curious about a few other little nuanced questions. One is around probiotics, because we're seeing some options for commercial probiotic mouthwashes sort of come onto the market. And is there any evidence or role for those in preventing decay?
Mouthwash itself doesn't physically remove the plaque on the teeth, so we need to mechanically, physically remove the plaque, and that is with toothbrushes and floss. Mouthwash has its place. Yes, they're antibacterial. Do they increase the good bacteria in the mouth? I'm not sure. Not sure.
Yeah, interesting area.
Yeah.
And Kim, does drinking out of baby bottles impact speech development or teeth development?
I think prolonged use of a baby bottle can have some impact, and it's usually recommended that bottles are weaned somewhere between 12 and 18 months. But I guess Stephen probably has got more information around how that would impact teeth development, because that in the end is what would then affect speech production.
Yeah, so bottle feeding is an huge risk of increasing, the risk of tooth decay. If we have a sweetened liquid in that bottle, then we see what we call bottle caries, where your teeth are just sitting once again in that sugar environment. Because if we're prolonged bottle feeding, then that suction can cause like an open bite of the teeth, similar to like thumb sucking, dummy sucking. Even milk, for example, we know milk has lactose. And if the baby is going to bed with the bottle in the mouth and just it's slowly just sipping, once again, it's that the teeth are sitting in that environment, that liquid environment, over a long period of time. So if you're putting your child to bed with a bottle, then we would just be saying make it water in the bottle.
And what about breast milk? What's the impact of breast milk on teeth?
Well, we do say breast milk is best, and we know breast milk has some sugar in it. I believe the breast milk itself, the risk of caries is quite low with breast milk.
Yeah. And breast milk has contained so many other nutrients and other aspects around prebiotics and other things like that that may in fact be beneficial, but it's an interesting thought. You mentioned there around thumb sucking and dummy use. So how does that impact teeth and then to Kim, to you, to speech development?
So thumb sucking, dummy sucking, what it does, it's a habit. And depending on the power of the suction, but you're introducing this object which then change the shape of the teeth, and then we all of a sudden end up with what we call like an open bite, where there's a gap between the top teeth and the bottom teeth, and you can see where that thumb is sitting. We can see where the dummy's been sitting. So we try to discourage dummy sucking as soon as possible. It's easier to throw a dummy out than it is a thumb. But usually by the age of 2, no older than 4, we would like that habit to be discouraged, to be gone completely. Easier said than done. I had a daughter that sucked her thumb till 9 and hence had orthodontic work, 4 teeth extracted. So tricks on stopping thumb sucking, then, we can put gloves on, mittens on, that stop nail biting stuff. The key is trying to make it a positive discussion with the child. We're at an age where we should no longer be sucking the dummy. We're at an age where we shouldn't be sucking our thumb. Let's try to stop sucking thumb through some rewards. Yeah, it's a tricky one, but the problem with it can cause orthodontic issues, like the relationship of the top teeth and the bottom teeth.
And its impact on speech development?
In terms of the changes structurally, that can have some impact on the clarity of some speech sounds. But for us, really, it's the time that you have a dummy in or a thumb in. It's a little bit like screen time. It just means you have less time to interact and be using words with the adults and the other children around you. So the earlier that's removed, you're more able to actually have that and communicate with others.
So it's a practice thing in a way, less practice.
Yeah, I think so. Yeah.
But it's also a tricky one because it's a comfort thing for that child.
Don't go anywhere. Our conversation continues after these messages.
Only 4.6% of Queensland children aged 8 to 11 years are eating the recommended amount of 5 vegetables every day. Healthy eating supports optimal growth and development, protects from illness, and supports lifelong healthy eating habits. Health and Wellbeing Queensland's Pick of the Crop initiative, delivered in more than 200 participating primary schools, aims to increase the opportunity for students to eat more vegetables and fruit. For more information, search Pick of the Crop on hw.qld.gov.au.
And now, back to the conversation. Just zooming out a little bit, Kim, how do we address different cultural beliefs and practices around language development and communication? We touched on it around bilingual or multilingualism, but any other aspects we want to add in here?
Cultural understanding and that feeling of belonging is really important, and having a sense of self helps that child understand who they are. Vocabulary and the words that children use can change, and as practitioners or clinicians, it's important for us to acknowledge where families come from and the beliefs that they might bring with them when they're seeing you, and also the way that they see their child's difficulty, if that's why they're meeting with you, and the resources that they have access to.
Excellent. Thank you. Let's finish this very informative episode on bringing together any other resources that we haven't mentioned, either mobile apps or online resources that you feel would be good for health professionals can use for their patient parents about language development or oral health. Stephen, do you want to kick us off?
There's so much information to assist in brushing children's teeth, like we mentioned before. And I know we're sometimes mindful how we go down the Dr. Google path, but generally the information is really good. And I think tooth decay is preventable, gum disease is preventable. Let's make this fun for children. Let's use the apps that are available, the videos of, that make it fun. Oral health should be fun.
Excellent. Thank you. And Kim?
In terms of speech and language development, our national body, Speech Pathology Australia, has got some resources on their website that families or practitioners and clinicians can access. One of those is a communication milestones chart, which outlines all of the typical milestone and development skills that children have as they develop their speech and language. And they've also got some fact sheets on there as well. Like I mentioned earlier, Raising Children website has got fabulous resources and videos. Another resource that is a social media resource, it's part of a Queensland-based resource actually, and it's called Read and Talk to Learn. And so they've developed a Facebook page and an Instagram page on 4 key messages, how parents can develop their child's sort of early language and literacy skills. And those 4 key messages are take time to connect, play to learn, share songs and stories every day, and talk together. And probably a lot of the things I've mentioned today have all fed out of those 4 key messages. But that's something that can be found on Facebook and Instagram as well.
It's a very positive message, I think, around the benefits and the focus on coming back down to good connection and communication and engagement between parent and child and between children, good role modelling around that, and having fun and enjoying the whole process and enhancing the relationship you have because of that. Well, thank you both very much for an informative podcast, and thank you for your time and experience today, Stephen and Kim.
Thank you.
Thank you, Sam.
Today we've been talking to Kim Dunston and Stephen Moore about speech development and oral health in the toddler years. For more information on today's topics, visit the Health and Wellbeing Queensland website at www.hw.qld.gov.au. If you've liked today's conversation, be sure to subscribe for future episode updates. We'll see you next time on the Clinician's Guide to the First 2,000 Days.